Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
In this week's episode of Dental Business RX, we're going to talk about presenting dental treatment, case presentations. And we're going to focus specifically on what is, by survey, everybody's least favorite part of the treatment presentation process, the financial discussion. If you look at the ingredients of a successful treatment presentation, from education to creating an understanding of what the treatment is so that the patient understands the importance and thereby wants to proceed, and then figuring out how to pay, you can see that each of these points are almost of equal importance. But with all of these parts and all the sales training I've done since the early 90s, I generally don't have any pushback, especially when we're training doctors, on anything other than the financial discussion. They're happy to discuss the other stuff, but the finances is a whole other story. And why is this? Money is a volatile subject. If you're listening to this and you happen to collect money in your practice, you may have noticed, or if you, as a doctor, you've brought up fees with patients, you may have noticed a patient go from completely happy to the second you bring up the fee, all of a sudden it's like they had a personality transplant. They're not nice anymore. So money is a volatile subject to discuss. And the financial discussion, when handled incorrectly, can become at best unpleasant. Now, on the flip side of this, if you do the financial discussion right, it can lead to higher collections, healthier patients because they're doing the treatment that they actually need, and you as the doctor getting to do more of the treatment that you love. And it's with that in mind that for this week's episode, I have a special guest, Sabri Blumberg, the Deputy Chief Operating Officer here at MGE. Now, many of you know Sabri if you've been listening to the podcast for a while. She was on episode 38 about organizing the front desk. She was on episode 6 on how to get more referrals. She was on episode 3 where we talked about rethinking the receptionist position, and episode 4 where she explained the treatment coordinator position. And again, to tell you a little bit about her, Sabri is our senior technical person here at MGE. She runs the entire delivery of our program, and she's worked with thousands and thousands of clients. And so I'm very happy to have her on this week. I think you're all hooked up over there, Sabri?
I am. I'm all set.
Okay, good. I can hear you good. All right, so I'm just going to roll with this, if that's all right.
Yeah.
I have a list of questions I'm going to ask you.
Okay.
Yes, I have a bunch of questions that I want answers. All right. Just kidding. All right, so between you and Chris Mankhouse, you meet with most of our new clients when they come in. And for years, it was mainly you.
Yeah.
All right. So out of all these new clients coming in, new to the MGE program, how many offices have trouble with this subject, either having the financial discussion in an effective way or just failing at the financial discussion, and possibly having to phase treatment at that point because a patient doesn't want to pay a huge out-of-pocket amount?
I think maybe 5% of the clients we have coming in here, or the guys that I talk to, don't have a problem with it.
Okay.
Like where it really isn't a problem, and anybody that is in a condition where they can afford the treatment is actually buying it.
All right. So you would say 95% of new clients have a problem with this. Got it. And so, all right. So this is obviously an issue.
Yeah.
So as far as now, just out of curiosity, what percentage, or I don't know if you can just estimate this, how many people just have trouble discussing finances altogether versus those that end up phasing treatment, if you had to do a percentage?
Oof. Okay, so
I know I'm just asking you for something that you probably don't have the exact answer to. This is just more my curiosity.
I would think that maybe 5% of the guys that walk in here actually discuss the finances. And the guys that do usually don't have a problem in this area.
Now, when you're saying discussing finances, you're specifically referring to the doctor discussing finance.
Correct.
Okay, so most doctors don't discuss finance at all.
Correct.
Got it.
And for them, it's really because it's interesting because you ask them, are you selling the cases? Mm-hmm. And the majority will say yes. Right? Not making that connection that you're not selling anything unless you're discussing money.
That's true. I haven't talked to a salesperson who didn't tell me I needed to pay.
Correct.
Right.
Correct. So when we're talking about sales, we're talking about financial discussion.
Got it.
Right. So, yeah.
So, yeah, if you don't get into finances, you're not really selling. You're doing the beginning of it, but you're not completing it.
Correct.
Got it. Okay, cool. All right. So let's jump into this as far as the discussion, the financial discussion. Mm-hmm. So how would you structure this so that people have something to compare up against? So the doctor has adequate time to meet with the patient.
Yeah.
And they've gone over what's wrong, what they want to do to fix it, why it's important to fix it. When does the financial discussion start?
Okay, well, it starts one of two different ways. Either throughout the entire discussion, the patient hasn't asked about the money, which is one way that it can start. The patient can just, throw in there like, yeah, but how much is all this going to cost me? And the doctor isn't done yet, right? So if the doctor isn't done explaining the treatment yet, I would not go over the finances. So that doesn't mean you can't say this is how much it's going to be, but you don't want to start figuring out the money unless the patient wants the treatment.
Okay.
And I guess that's the qualifying point where you move from education into finances is the patient must want the treatment.
Yeah, interesting
before
point.
you start talking about money, because the money's going to go nowhere if they don't want to buy it.
Okay.
Right? And a patient is not necessarily going to tell you they don't want to buy it, because patients are going to be polite most of the time and go, yes, I understand why I need it. Yes, it all sounds good. Well, I have to think about it.
Right.
Or, these are the normal ways that we get out of, quote unquote, being sold. Right?
I just say I have to talk to my wife.
Right. I mean, we have... And I say I have to talk to my husband, right? It's like most people are nice, right? So they're not going to come right out and tell you, I don't want to do that, or, or I'm scared to do it, or I didn't understand you. And I guess, so you have to make sure that treatment presentation is done in a way that it's understandable by the patient, which means you have to use small words that people can understand. We didn't all go off and get a dental degree.
Right. So maybe just or non-medical terminology.
That's what I mean. Right. Like use normal terminology that normal people who didn't go to dental school or have a dental background understand. Right. So that the patient understands, what am I buying? Why am I buying it? And what problem is this going to handle or prevent from happening in the future?
Okay. So now what you're saying, if I can clarify, so if let's say I'm talking to you as you're talking to me, you're the doc, I'm the patient.
Yeah.
You're telling me, okay, Jeff, so here's what we want to do to fix this. And you're going to need 3 crowns here. And then you start talking about replacing a tooth with an implant. And then in the middle of explaining all this to me, I stop you and I go, whoa, doctor, how much is all this going to cost?
Right.
How would you handle that?
Well, the first thing I would tell the patients, you can give them a number. You can say it's probably to fix all of this going to cost about $15,000 or $20,000 or whatever the price is. But you don't want to start having that discussion then. So you want to tell the patient something along the lines of, well, it's going to be about $20,000, but I don't actually want to discuss the money right now. What's more important is that you understand what's happening with you and what needs to happen in order to correct that, and that you actually want that before we start talking about the money. So forget about the money for a second, and let's talk about you and your health.
Well, I like how you handled that. I just wanted to comment on that. Only because what's interesting, because I was thinking about this.
Yeah.
If I were to ask you, well, doc, how much is all this going to cost? And you were to respond with, I'm going to tell you that in a minute.
Yeah.
Because you could.
Yeah, you could.
Right. But then the problem is everything you tell me from that point until you tell me how much it's going to cost.
Yeah.
Right? I'm not going to be hearing.
Correct, because all you're thinking about is how much is this going to cost me.
Right.
Right.
Whereas if you tell me, it's going to be about $20,000, I might go, whoa, I don't have that kind of money. And you go, look, just relax. We'll get into that next, but let me finish with what's going on.
Yeah.
I mean, I guess I might be thinking about it then too.
Yeah, but you can also not make it a problem for the patient right there.
Right.
You can let them know, listen, it's going to cost $20,000. And the patient goes, whoa, that's a lot of money. I don't have that. You say, listen, I totally understand that. Right. And this isn't what we're talking about right now isn't about that.
Got it.
That's something we're going to have to figure out later. The first thing the reason why you came to me is to find out what's happening and how do I keep my teeth and how do I stay healthy.
Got it.
So that's what I want to discuss with you. Once you understand that and want that, now we can figure out a plan on how do we do that.
No, I like that. So you've handled what they've asked.
Correct.
I guess you haven't. Yeah.
I guess the most important thing, however you want to handle it, if the patient brings it up in the middle of the conversation and you're not done yet, you have to handle it in such a way that it doesn't become a problem.
Got it.
for the patient so that their attention doesn't stick on that and they can listen to what you're saying.
Right. Otherwise, yeah, that's all they're thinking about. Everything you say from that point forward, they're not listening to at all.
That's exactly right.
Okay.
So that's one way the money can come up, in which case you just kind of put it off. But the time when you want to have that financial discussion is when the patient understands what they need and wants it.
Okay.
So now how do you know whether the patient wants it?
Yes.
Right? Well,
Yes.
you just ask them, would you like to do this?
Okay.
That's the simplicity. I mean, how do you find something out? You ask, right? And ultimately, sales is just a conversation.
That was too easy.
It is too
I was
easy.
expecting this. Wait, their left eyebrow is going to twitch
No.
or something. Okay.
No.
So you finished explaining what it is, what they need, what you want to do.
Yeah.
And then you would say,
Would you like to do this?
all right, now let's say they say,
Yeah.
I know I'm kind of putting you on the spot here.
Yeah.
This is the great part about having Sabri because
Yeah.
she handles all of this, right? So let's say they say, well, yeah, it sounds great, but how much is it going to cost?
Yeah, I would say an arm and a leg and your firstborn, right? So the money we already know is a problem.
Got it.
The money we already know we're going to have to figure out, right? So let's forget about the money for a second. What I want to know is, do you want to do this? Do you have any questions or concerns about this?
Got it. Okay, so you're bringing me right back to getting your question answered.
I want my question answered. Because if they say, no, I don't want to do this, or I have more concerns, or I'm afraid of how much, like, is this going to hurt me, or how much time am I going to have to take off work to do this? I want to handle those things because you understand if somebody wants to do something, now they are working with you to figure out the money. It's not you against them. They want it.
Right.
And you are just simply helping them solve that problem. But you have their cooperation. You don't actually have their cooperation until they want to buy something. If I want to buy something, regardless of how much it costs, I will try to figure it out.
Got it.
If I don't want to buy something, I will give probably a million different polite excuses as to why I can't.
Right. Interesting.
Right? So I don't want to have that financial discussion until then.
Now, and this made me think of something as you're talking.
Yeah.
Second opinions.
Yes.
Not doing a second opinion because those are usually easier to sell.
Yes.
Right. But let's say my response to you instead, you've asked me, Jeff, do you want to do this? And I go, you know, it seems like a lot of work. I wasn't expecting this much. I'm thinking about getting a second opinion, which I don't know if many people would say. But
you know, some people do.
Sure.
And what I would usually ask them when I have people ask me for a second opinion is I just ask them, what are you hoping they're going to say?
Yeah. Interesting.
You know, I know this is a problem and I know this is a lot to look at, right? And you can probably get people to do it a little bit less or a little bit more. But ultimately what you want is you just want it done right.
Got it.
Right? So I know I kind of caught you off guard a little bit, right? So you can try to put them at ease. And some people are going to go for a second opinion. And you know what? There's not much you can do about it if they want to do that and they have that right.
Right.
To go for a second opinion. But usually it's just they're hoping that the problem isn't there.
Yeah. Instead of 3 crowns, I need 1.
Right.
Yeah.
So I would just say, listen, what do you like? Somebody might phase it differently, right? But that tooth is cracked. There's nothing anybody like. They may say, okay, we're going to put the treatment off, and we're just going to start with the ones that are broken already.
Right.
Right. That's not the way I do it. I just get it over with and do it in a way that it doesn't have to be redone again.
Okay. So you've kind of laid out. You're going to make sure the person wants it before you start getting into finances.
Yeah.
I thought that was. Oh, sorry.
Yeah.
Go ahead.
Sometimes it's hard for people to face that they actually need to do something and need to confront what's going on in their mouth. People don't look in their mouth and they're not very aware of what's going on in their mouth. So sometimes you totally catch them off guard.
Right.
So sometimes just talking with them about it kind of gives them a little bit of time to think with it and come to the, get comfortable or more comfortable with the idea. Like, yeah, we got a problem here.
Well, you know, what's interesting about that,
Yeah.
I know I'm interviewing you here, but I wanted to interject this
No,
because
please.
you're making me think of things as we go.
Yeah.
And this is something when we go over the whole exam to consultation or sales process in
Yeah.
the seminars, 30% of the negative reviews online have to do with the treatment planning process.
Yes.
You know, I went to this office and I just wanted to get my teeth cleaned and they told me I needed $4,000 worth of work.
Yeah.
Right. Usually what's going wrong with these, and this is something we teach our clients, is if you have a person come in, when you're meeting this new patient for the first time, you have to understand their mindset.
Yes.
Right? So if someone, you're doing your exam, your initial exam, and you find all kinds of stuff wrong.
Yeah.
And you ask the patient, about their past dental experiences, and their response is, oh, my doctor said I was a star patient and I did everything right and said my teeth were perfect and I've never had a problem. And you can see all kinds of a mess going on in there.
Yeah.
You need to start dropping hints now.
Yeah.
During the exam. Because again, if you wait till the consultation at that point, that's just going to be earth shattering to the person.
That's exactly right.
Yeah.
And it's a good point that you bring up, because you're gathering data from the patient at that point to find out, how do I present this case?
Right.
What is this patient's mindset? And you know what? There are doctors with different philosophies. There are doctors that have they put watches on everything, even though I don't know what they're watching. It's all falling apart, right? But then when you present it, you can present it in a different way. You can say, listen, I can see that you have really done everything in your power, right, to take care of your teeth, and your doctor's done a fantastic job maintaining it. It's now unfortunately gotten to the point where we can't maintain it anymore. We have to fix some things.
Right.
Right? And that happens to everybody. Sooner or later, if you use your teeth, and I assume you are, right, that use is going to start breaking down some things, and you can watch that breakdown happen and try to maintain it, which your doctor did an excellent job. But I'm starting to get concerned about what's actually happening now.
Sorry. I'm so sorry.
No, it's totally fine. In other words, it changes the way you're presenting it, because this guy just told you, my doctor did an excellent job. Well, you don't have to say, well, the guy was wrong.
Right.
You say, yeah, he did.
What do you think about, and we've had some clients do this, where they'll whip out the intraoral camera or something like this, and they'll show them, do you see this cusp is missing on that tooth?
Yeah.
You see that?
Yeah.
Wow. You see the big dark spot over here?
Yeah.
Over here on the side of this tooth? Do you see how there's this big, like they show them. You see that big open space there on that crown you had done? Like, because then the person starts to, visible evidence is great.
Yes.
But I think a combination of that plus what you're saying, I think kind of alleviates those concerns, and it would handle a lot of these problems right from the get-go.
Correct. And the thing that you're saying that's so very, very valid is you're kind of doing it on a gradient instead of just coming right out and go, okay, well, this is what's really going on with you. And the person's just caught completely off guard. You've dropped little hints that the person starts thinking, oh, well, maybe it's not as perfect as I thought it was.
Right.
And you give them more time to adjust to the idea.
Yeah, no, that's great.
Right.
That's great. Okay, good. All right, so you've gotten to the point where you've brought up finances with the patient.
Yeah.
Okay, so now how far, because let me bring the treatment coordinator into this discussion now, right? Or whoever's acting as the treatment coordinator, the office manager or whoever it is, right? So I'm going to bring them into this discussion, because obviously the doctor is not having this discussion completely alone the whole time, ideally, right? So the first question I would have is, when would you have that other team member in the room?
Okay. That depends on the training of that other team member.
Okay.
So if you have a true bona fide financial coordinator or treatment coordinator, a salesperson, somebody who knows how to do this, is trained at it and is successful at it, then you can bring them on fairly early on, and you can turn it over fairly early on.
Sure.
Right? Because if you have somebody who's not trained on how to do this, and by trained, I don't just mean you've told them how to do it. I'm talking about they have a track record of being able to do this successfully.
Yeah.
Right? You may only bring them in at the end after you've worked everything out, and they're just essentially doing your paperwork.
Got it. So the point at which you would turn over, but the doctor is always going to mention the fee.
Absolutely.
Okay, so if I've got a really good treatment coordinator, then it might just be I've got them in the room with me for the whole presentation.
That depends on the size of the case.
Okay, but let's say it's a, I don't know, $5,000, $6,000, $10,000 case.
Yeah.
All right, so that they're in the room with me in the beginning.
Yeah, absolutely.
And I can just introduce them to the patient. This is Jane or Joe, my treatment coordinator. They're going to be helping with various points of this. So,
yes.
And I guess a patient's used to having a dental assistant in the room. So,
absolutely. You can also let them know, listen, they are completely trained on costs. How do you pay for things and insurances? So I want them in the room so that if you have any of those questions, they can answer them for you.
So they're there, and we start off, and I get into how much the treatment plan is going to cost either at the end after we've determined the patient wants it.
Yeah.
And then I've got a really good treatment coordinator. So at that point, what am I going to do? I've got good treatment coordinator. I've mentioned cost. What's next?
Well, the first thing that I would do, I wouldn't just turn it over to the treatment coordinator. If I was the doctor doing that case presentation, I would want to know, is the patient trying to figure out how to pay for it?
Okay, how would we know that?
Ask them, is there any, and again, just ask. Like, do you have any idea how you would like to pay for something like that?
Okay.
Right? Who understands the finances best?
Well, the patient.
The patient.
Yeah.
So I would ask the patient, do you have any idea? Understand again, if the person wants to buy the treatment, they're probably already thinking of ways like, how do I pay for this? They're probably already trying to solve that problem. The only patient who doesn't try to solve that problem at all is the patient who doesn't want it.
Got it.
Right? If the patient is not trying to solve the financial problem, this is what I said earlier, you want them working with you. So just ask.
Got it.
Do you have any idea how you want to pay for something like this or how you would pay for something like this?
And this is where you may hear, well, do you take payment plans or could I put something down and pay over time? Or,
Right.
Yeah.
Right. And then, so as soon as the patient starts giving me some solutions, if you have a good treatment coordinator, that's when you can turn it over.
Got it.
Like, do you take payment plans, things like that? Yep, we have all kinds of different options that we can do. And, we obviously recommend outside financing. We don't recommend in-house financing at MGE. So then, yeah, absolutely. Our treatment coordinator is going to go all your different options with you and work out something that's comfortable for you. And then I really look forward to seeing you very soon to start the treatment.
Okay, and that's where the doc, if they want, can help get that treatment plan scheduled. Even though the financial arrangements aren't done yet, gets the patient thinking with where on the schedule they'd want them.
That's really the best way to do it.
Yeah, then
is
they have
just
some
get
control.
it started. Yeah.
All right, so then I've turned it over to you've turned it over to the treatment coordinator. I asked you how, could I do a payment plan? You go, yeah, my treatment coordinator, Joe here, will help you with that.
Exactly.
And then you leave the room?
Then I leave the room.
Or they leave the room or wherever.
Exactly.
Okay, good. Now that's with a good treatment coordinator.
Yes.
Let's say we have a treatment coordinator who is not, I hate to not use the word bad. It's not bad.
Well, how about they're still being trained?
They're untrained. They're
Yeah.
new. They don't know what they're doing.
Yeah.
Right? All right. So how far are you going to take it as the doc? You've asked me, do I want the treatment? I say absolutely.
Yeah.
You tell me the cost. First off, when are we bringing this untrained treatment coordinator in the room?
Usually, if you're training them, you want them there as part of their training because like that, they also understand the way that you're explaining treatment, the way that you do a treatment presentation. Because in an ideal world, a treatment coordinator could do all of this.
Got it.
You have to take a look at it, right? So there are practices that run where the treatment coordinator does all of this.
Right.
The doctor who owns the practice may not even be there or be there very limited. And the associates that are working in the practice are not trained on how to do this at all.
So the treatment coordinator does the whole.
Correct.
Got it.
So in an ideal world, the treatment coordinator could do all of this. So if you're training somebody new, I would want them to be part of all of it so they can also see how are you answering questions, right? How are you addressing their concerns? Because if you think as you're explaining the treatment that these concerns about finances or, they're scared or time or things like that are not going to come up, I've never seen that happen. You're going to have some questions and you want to know how, you want your treatment coordinator to know how would you handle those things and how do you want them handled in your practice?
All right. So you want them there. Is there ever a time you wouldn't want them there the whole time?
Yes. When you have somebody, a treatment coordinator, when you have a smaller treatment plan, right? So there's really no reason.
I see.
And what's a smaller treatment plan is different from doctor to
£2,
doctor.
£3. The patient has to pay $800.
Right. Whatever you consider to be a smaller treatment plan, there's no reason for your treatment coordinator to be in there. Or if you have a really well-trained treatment coordinator and you guys have been working together and you're totally in sync, they don't need to be there for the entire presentation. You can bring them in when you start going over the finances.
Got it. Okay, fair enough.
Yeah.
All right, so now we're back. Sorry, I kind of digressed there. So we're back to this point. We have this newer treatment coordinator. We've had them there for the whole presentation. You've verified as the doctor that I want the treatment plan. As the patient, how much further are you going to take it? So let's say the next question, like you would ask me, how would you pay for something like this?
Yeah.
And then how far are you going to take this before you send me off with this newer person?
All the way.
So what is all the way?
Meaning all the way up to taking the money.
Okay, so you're going to get into I'm going to tell you, well, can I do a payment plan? Or, well,
say absolutely. But I do want to get into this real quick, right? When you use outside finance companies, there's periods in time when it's easy to finance people, and then there's periods in time when it's not easy to finance people, right? And you see that. We've seen it today. We see the financing lines tightening up a little bit. We saw it in 2008.
Yeah.
We saw it.
You know what's funny? I have to mention this. You know, that's technically termed that period 0809 as the GFC, the Great Financial Crisis, right?
Yes.
The market meltdown or whatever.
Yes.
What's funny is when we were talking about this subject, because I know what you're going to bring up next, and it's very, very timely and needful in my opinion.
Yes.
I think it's great that you're bringing it up. I'm glad you're bringing it up.
Yeah.
But now when I'm lecturing and I bring up, you know, the Great Financial Crisis, I get stared at like as if I'm talking about the Great Depression or something. Like I would remember that. 1929, when the stock market crashed, my spats were dirty when I jumped out the window. You know, but
Yes, Jeff, we're old.
Exactly. Yeah. But so now I have to survey the room.
Yeah.
How many people? I mean, they were all alive in 2009, but how many people were actually working in 2008 and 9? And it's about 50% of the room now.
Yeah, that's funny.
It's just funny. So you brought up this idea of financing in 08 and 09. I thought I'd throw that in there. It was just funny.
Right. So financing in 08 or 9 was traumatic.
But,
very few people.
Right. But before that, it was easy peasy.
You could finance anybody. You could finance your pet.
Yeah. Well, or you just had to have a pen and be alive.
That's pretty much it.
Yeah. I mean, you couldn't finance your pet, I don't think.
No, you couldn't.
I know but what's funny, so then we saw a lot of offices go completely nuts on, you know, everything was just patient financing. And when the patient would bring up how much things cost, it was, oh, well, we've got all these different payment plans you can do.
Right.
And I remember the reason I think this is cool, and I'll let you talk here in a sec, so I'm hogging time, but you were kind of going against the current at that point because you were telling people, don't do this. And this was before things went south.
Yeah.
Because it was, you know, easy approvals. Then all of a sudden, nobody was getting approved, and you had docs freaking out because they'd become so addicted and accustomed to easy financing.
That's right.
But then even before it became hard,
you
were telling people, don't do this. And so I'll let you do your thing now as far as what you were saying, because it was really good.
Right. So you don't know whether a patient's going to get approved or not for financing. You do not work for that finance company. You do not know their criteria, right? And when somebody gets disapproved for financing, right, it's a little bit of a kick in the gut.
Yeah.
Usually. It's most people do not come, do not get happier.
Right.
When usually they become quite sad.
It's degrading.
It's degrading to get disapproved for financing, like you're not credit worthy. Right. And the interesting part of it is that a lot of these people actually would have been getting approved the prior months, right? It would have been totally fine. But now suddenly they're not, right? Once somebody's disapproved for financing, to have to go back in and have that financial discussion now, when they are emotionally like a little bit crippled at that point, is hard and almost impossible to do.
Got it.
Right. So the easiest thing is to address that before.
Okay.
You do financing. The easiest thing is to say the person will go do you take a payment plan? And you can say, yeah, absolutely. We use outside financing, but from what I have observed with outside financing is that they have all kinds of, like their credit criteria. I can't always guarantee who's going to get approved and who's not. I've seen people that I thought should not get approved.
Right.
And I've seen people with great credit scores, everything was perfect, get disapproved. So we're not quite sure what their criteria are, but we can absolutely try that. The thing that I want to know is there any other way for you to do it besides that?
Okay, so you're figuring that out before you're applying for all whatever it is, Sunbit, Care Credit.
The plan B, so to speak. I want to have a plan B before I apply for financing and I find out it doesn't work. The other thing that's happening with financing today is that the interest rates that they're charging are skyrocketing. And that's today. I can't guarantee. I mean, if you're listening to this podcast a year from now, it might be totally different. But right now, financing would not be my first option if I'm sitting down
But you
with
know
a patient.
what's interesting about that? I know credit card rates are starting to hike.
Yeah.
It doesn't necessarily. I was talking to a client a week ago.
Yeah.
It hasn't affected the care credit. What do they call that? The discount percentage or buyback or whatever.
No.
It has not affected that yet.
No.
But when you're offering interest-free financing.
Correct.
But I can't imagine that it won't sooner than later. And if guys are doing bigger cases, the all on 4s or 6s, those are variable interest rates. So
That's exactly right. And that's the problem. So if somebody does 0% financing, obviously the interest rate doesn't really matter, but if you're doing larger cases, usually people can't make those payments.
Right.
People can make those larger payments. They usually would just pay you.
That's true.
But again, even if you were getting people approved left, right, and center, the fees that those finance companies charge are, in my view, outrageous.
Yeah.
Right.
We're not anti-finance company.
No, I am not at all. But if I can avoid paying that fee, I'm going to.
No, I agree with you. Because a credit card fee, even though whoever you use your merchant services probably said you were getting 1.8%, it's probably 3. They're always 3.
Oh, yeah.
There's the interchange fee and the connection fee and all the other
They have
fees.
all kinds of fees.
Yeah, merchant fees are 1.8.
Yes.
But everything else, the space shuttle fee. Anyway, but I think one of them, the 2-year financing with one company right now is 14.99.
Oh, I've heard them go up over 28% at this point.
Not for 2 years, though. I don't think that I've heard. Can we say which company?
No.
Okay, we won't. All right, but I know that the main one everybody uses, Care Credit, I think is 14.99.
Yeah, no, that's Care Credit, but there's other companies.
To clarify, Care Credit is 14.99, not
clarify,
the other 28.
I am not talking about Care Credit.
But still, even with that, and the Care Credit's great, and the plus with Care Credit is adoption utilization. A lot of people have Care Credit, and it's a credit line.
Yes.
So they always have that credit card.
Versus a loan.
Right.
That's absolutely true.
But the problem is 14.99, and this is what I was saying. I was doing the finance seminar recently. It's so funny. This always boils down to with me and you a discussion.
Yeah.
This is like when we do live streams. It starts as an interview.
and then it becomes
just
a discussion.
Well, it's an interesting point though. I was doing the finance seminar last week.
Yeah.
Or the week before last
Yeah,
with clients.
a couple of weeks ago.
And part of the problem some people run into,
Yeah.
because this has to do with paying an associate, especially if you're paying the associate on production.
Yeah.
Or bonus plans, if you're
Yeah.
bonusing the staff on collections.
Yeah.
Well, when you sell a case for $10,000
Yeah.
and the patient pays with Care Credit, what's usually going into Dentrix at that point is $10,000 and then you're writing off the merchant fee afterwards.
That's correct.
If it was 2-year financing, you're writing off $1,499.
That's right.
But your team or your staff, if they're on a bonus plan, is working on a gross number.
Yes.
Or your associate
Yes.
is working off a gross production number. The
Yeah.
production, if you logged $10,000, is going to be $10,000.
That's right.
So people weren't factoring that in.
Right. So
then
they're
you're
paying bonuses on money they never received. I
Right.
see that too.
Well, and it's funny because then you also end up with your QuickBooks and your, if you use QuickBooks, and your Dentrix not agreeing.
Yes.
Because that shows it's 10,000 collections and an expense after the fact. But really, you're not, because Care Credit used to do it like credit cards do it, right? Where you would get X amount of dollars and then they would take their money out afterwards.
Right.
They don't do that anymore.
No.
Because people, I'm sure they went back to the well to get some payments and didn't get them.
Right.
So now you're really only getting $8,501 on that $10,000 case.
Correct.
So that's an accounting thing that I told them, I would personally.
No, but it's a good point. People need to watch that. And
Oh, no, it's a finance seminar. They can't watch it if they're not a client.
No, people need to watch that.
Oh,
they need
okay.
to watch the kind of bonus plans or production pay plans that they set up
Right.
to make sure that they're not paying on money that they will never receive.
Right. And my take on this when I was talking to the clients was two things, right? Obviously, with an associate, they have to understand you're only paying on what you can collect.
Yes.
So you're only paying on that $8,501, not the $10,000.
Yes.
Right. Number one. Number two is staff. You want to give the team
Yeah.
a number. You don't want to give them a number. We've collected $150,000 less finance charges because then they can't think with it. They just
That's
need
right.
a number.
That's right.
So I personally, if I were to do this, and this is not accounting advice,
Yeah.
Talk to your accountant. I would just enter, because from a taxation perspective, it's probably going to look like, again, I'm not an accountant or tax attorney, going to look like the same thing. If you enter 8,501 in the system and then you add some type of a credit to their account to balance it out,
Yes.
right? it's going to still look like you made $8,501.
That's right.
If you brought in 10,000, quote, air quotes, and you wrote off $1,499, you still only made $8,501.
That's right.
You're still not under or over reporting your income, but then the team is working with an actual number.
Correct.
Yeah.
No, that's a good point.
Sorry, I went completely off the rails with this.
Completely off the rails,
Sorry.
but it's totally fine because you bring up a point that I see a lot of guys doing, and we don't actually ever bring it up. But I will tell you something. The thing that I do want to bring up that is appropriate is if you have your Care Credit or whatever finance company you use write-off or fees. And then most of the guys we're dealing with are still taking PPO, so they have that write-off as well, right?
Yeah.
I mean, you start looking at your profit margin and you're wondering why your numbers look good and you're not taking home a bigger paycheck.
Right.
Right. It's a bad thing.
No, I agree.
So, obviously we are recommending heavily get out of insurance plans now.
Sure.
We're working very, very, very industriously with our clients at MGE to get them out. They need to be out.
I agree.
But on financing, to go bring it back to the financial.
Yeah, before
we're
I think we both kind of did it because you brought up the fees, and I'm like, yeah, I'm glad you brought that up because that is a thing. That's a lot of money. I don't do that with credit cards because my point being is if someone collects $10,000 from a credit card, I wouldn't put, I'm going to pay 2% in charges.
Yeah.
Like that's fine. That's a cost of doing business. But 14.99 or even 9.99 is a heck of a lot different than 2.
Right. So you may ask the patient if they say, do you do payment plans? You can say, yeah, I mean, it's my least favorite option. Do you have any other way to do it? Besides that, do you have a credit card you can put it on or something like that?
Well, in those cases, you can offer some type of a prepaid discount or a bookkeeping discount or something, in which for some people, that's pretty good.
Correct. And that's usually better than what the finance company is going to charge you.
Yeah. I mean, you don't have to necessarily tell them how much the finance company is charging you.
No, of course not.
Yeah. But yeah, you're right. I mean, if I'm going to eat, even if you gave a person a 5% prepaid discount, let's take that $10,000 case, $10,000 case, you're going to give them a 5% prepaid discount or bookkeeping discount. So now that's a $9,500 collections.
That's right.
Versus if I did 2-year financing.
Plus your 3% credit card fee.
Okay. Yeah. Right. But I'm collecting $9,500.
Right.
Whereas with the if I'm doing 2-year financing, I'm only collecting $8,500.
That's right.
And the patient can even use these cards they don't have to pay interest on for 2 years and
That's
all kinds
exactly
of jazz.
right.
Yeah.
And it usually, I mean, with as much as they're tightening financing these days, if the patient qualifies for financing, usually they also have credit cards.
That's true.
That they can put it on. And you can even tell them, like, do you have a 0% credit card? That might be better for you.
Yeah, that's a good point.
Right? Or do you have a card that you can get that 0%? They're not difficult to get if a person's credit is decent.
All right, so you're starting off the conversation to bring us back because we could go off on this for hours.
Right. Yeah, bring
So
me back to where we started.
So
Yeah.
when you mentioned plan B, right? So there's plan A, patient says, I want to do a payment plan.
Yes.
Great, we have payment plans. So that's
Yeah.
plan A. But then you're coming back at them, okay, good. Credit criteria is all over the place. You've seen people get disapproved that you thought would get approved and vice versa.
Right. I'm going to try to get them off this payment plan.
But you're bringing it up because you're citing the unpredictability of financial companies.
Yes.
Okay. And then now you're bringing it back to, all right, so now how else would you pay for how would you normally pay for something like this? Or how would you pay for this? And the person might say, well, do you take credit cards? I mean, at that point, would it be appropriate to bring up the prepaid discount or?
Absolutely.
Okay.
You can say yes, absolutely. As a matter of fact, if you prepay for it so that we just have the money over with and we can just concentrate on your treatment, I actually give you a discount because ultimately that's what I want. I want to concentrate on your treatment.
So then the patient can go, yeah, I have a Visa that would hold that and blah, blah, blah.
Great.
And then so you figured that out.
Yeah.
They have a Visa they could put it on. They could write you a check, whatever they could do.
Yeah.
Then they come back and you say, but I'd like to do a payment plan.
Right. So if they are like, I really don't want to use the Visa, I can't, and that's what they want, and I can't get them to change their mind on that.
Yeah.
I'm going to run the financing. Now, if they get disapproved for the financing at that point, you can go, yup, you got disapproved. But we already knew that.
Yeah.
Right. We already knew that. And I'm so sorry. And we're not quite sure what's going on. And
Yeah.
you blame the finance company, not the patient.
Got it.
So that the patient doesn't feel it has anything to do with them. Because truthfully, usually it doesn't. right? Or
Unless they have
sometimes
like
it
a
does.
520 credit score or something.
Yeah,
in which
so,
case it
okay,
does.
fine. Sometimes it does, right?
All right, so, I told you these things were unpredictable,
Yeah.
but you've now worked out that they could put it on a visa.
Yep. So then you just say, so we're going to put it on a visa then. Is that all right with you? And do you have that visa with you?
Okay, yes, I do.
Perfect. And it actually works out better for you because you actually get it a little bit cheaper this way.
All right, so now this all started with the inexperienced treatment coordinator.
Yes.
So that this is the doctor having this entire conversation with me.
Absolutely.
And now you're going to send me off with Joe, your inexperienced treatment coordinator, to go put it on my visa.
Or run the credit app.
Right, or run the credit app or whatever.
Correct.
Got
With
it.
the understanding that the treatment coordinator knows that if anything goes different than what we discussed, they come and get me right away.
Got it. Okay, now, but if this was an experienced treatment coordinator, you would have just brought up the fee.
If it was a I've seen super experienced treatment coordinators where the doctor doesn't even go over the treatment.
Got it. Well,
Right?
that's way down the road.
That's way down
But
the
for
road.
the-
So
for
that's
the
one
majority-
side of the pendulum versus.
For majority offices, the doc's going to mention the fee
Yeah.
and get into how the patient would pay to some degree.
Yeah.
They could steer them away from patient financing if they want and into something else, and then send them off with somebody to do it.
Right.
Got it. Okay, good. It's a lot of info.
I know.
No,
I know.
it's good though. It's timely and it's good. And you started talking about this Plan A, Plan B back in 2007.
I've never been a fan of being dependent upon one way to make money.
Right. No, that's smart. And
Right.
I remember you telling clients this when everything was great and cake and, it was no problem to get patients approved for everything. And there were the ninja loans, no
That's
income,
right.
no job verification loans.
That's right.
And credit was easy. And you're telling people like, nah, you better keep it was almost like keeping a diversity of payment methods in your payment ecosystem.
That's exactly
Yeah.
right. So if one thing breaks,
Yeah.
something else will pick up the slack.
Yeah, that was
right. And
smart.
you want to do that with everything. You want to do that with your marketing. You want to. Why do you cross-train staff?
Right. Yeah. Good point. Good point.
Right.
All right. So last question for you.
Yes.
So I think we've blown the 30 minutes or less thing, which is
Totally.
fine. Okay. So you've gone over how the financial discussion is supposed to happen, what the criteria are, what to do with a less experienced or more experienced treatment coordinator, which was awesome. And then I went completely off the rails talking about, you started
it was
though.
good.
Yeah. Treatment coordinator has the patient, is talking about how they're going to pay, and the patient is balking again.
Yes.
Okay. So at that point, what happens?
If the treatment coordinator is not trained on how to handle that,
But let's say they are trained and they can't handle this objection. A patient won't get off of it and is going to change what they agreed to with the doctor.
say, okay, good, then I'm going to get the doctor. So, because the doctor's expecting you to do this treatment. So, if you are changing the treatment you're doing, right, or then the doctor would like to be involved in that decision because it's going to have some consequences for you and your overall health.
Okay. And then next point.
Yeah.
Now, because we're assuming this treatment coordinator was in the room with this patient and got
Correct.
to see how the doctor answered their questions.
Correct.
Because I get asked this as a follow-up all the time.
Yeah.
All right. So, but the doctor's in the middle of a root canal.
Yeah.
So what now?
So you can always schedule the patient to come back.
Right. I mean, I guess the point
There's
is,
nothing you can do
Right.
about that. But understand that as the treatment coordinator, and people learn this in the sales seminars and also in DDS Success, when things are rolling along, the patient wants to do the treatment and you get into the financial discussion, and how you started out this podcast is when you start talking about finances, no matter how well you do it, sometimes you get a different person, or sometimes it doesn't always stay where you want it to be emotionally.
Right.
Right? Things change. It's a volatile subject.
Sure.
It's an emotional subject. Right? So it does happen that the patient changes their mind in the middle of it. And what do? You bring them back to the treatment.
right.
So you can say to the patient, like a patient goes, you know what, this is too much trouble. I don't know if I want to do this. I really need to think about this, whatever. So they were going along fine. They wanted to do it. And now suddenly they are balking, right? You can ask them what's happening. And they can say, well, it's all too much. I wasn't expecting this, whatever it is. And acknowledge that and say, okay, listen, I totally understand. Let's go back to why we're doing this.
Got it. I like that.
Right? And bring them back to wanting the treatment. And talk about the treatment. Stop talking about the money at that point because they no longer want the treatment. And that is the rule. You don't talk about money unless the person wants to buy it.
No, that's great. That's something that is a great rule to operate by.
Correct.
If it's all about the money at that point and it's not going anywhere, it isn't about the money.
That's when it becomes a drag for everybody, for you and the patient.
Well, because you're talking about the wrong thing.
That's exactly right.
Yeah.
And it's not about the money. You didn't become a doctor only because you wanted to make money. I mean, money's nice and we need money and that's all good. But ultimately, you just want to help the patient.
Right.
So help the patient and concentrate on that.
All right, so I could walk away with this concept of so if the money discussion is just going off the rails, drop it, move back to the treatment.
Correct.
Because it's not the money.
Never.
Got it.
It's never the money unless the patient is destitute. And if the patient honestly has a health situation and is completely destitute and cannot receive the care that they need in your practice because they are in a situation in their life where they simply can't afford it, but they need it, you better get them somewhere where they can get the treatment.
They can go to the school, or you might do various types of charity cases that you want to do.
That's exactly right.
Yeah.
Ultimately, this is about the patient.
Got it. Okay, good. Well, this was awesome.
Yes.
Is there any last things that you want to add to this, or?
Yeah, and I think it's what we were talking about at the end here. It's about the patient.
Right.
Right. And the money is simply something that has to be confronted so that you can help the patient. And it's something that you have to get out of the way. And the patient has to understand as you're having this conversation with the patient, right, that this is something that you don't like talking about, they don't like talking about. Right? It's not your favorite part, but it's something that you're going to have to confront together.
Interesting.
And that's what you're doing so that you can get them healthy.
Good. I love it.
Yeah.
And I think that's a good place for us to close. I've kept you for quite a while.
That's
I
okay.
super appreciate you coming on this week.
Yeah.
And if you want to hear more of Sabri, you can definitely see her. Well, obviously you see her around MGE. If you're an MGE client, you know Sabri. But Sabri does all of our training on the treatment coordinator course. She also does, it was great, she does a lot of the demos for the schedule and financial coordinator course, especially having these discussions, which are very cool, on DDS Success. That's our online training platform. You could also see her at MGE at various seminars. Sabri, you're awesome. Thank you so much for coming on this week.
Thank you.
And folks, that's all I have for you this week. I hope this helped. And if you enjoyed this episode, you want to see future episodes like this, don't forget to follow us or subscribe, depending on the podcast platform that you're listening to us on. And if you need any help of any kind in your practice, you want to find out more about MGE, you can visit us online at mgeonline.com or call us at 800-640-1140. Again, appreciate you taking the time out this week to listen to the show, and we'll see you at the next episode.